Okay, so we chose to focus on Jean Watson. She focuses on a more holistic approach and development of human caring. Holistic nursing is the idea of healing the mind, body, and soul. She believes that this must be focused on in order for the patient to have complete healing. When using the four nursing meta paradigms, Watson views the person as a unity of mind, body, spirit, and nature. She addresses the patient as a person whose soul has a body and not whose body has a soul. Watson defined health as the unity of and harmony within the mind, body, and soul associated with the degree of congruence between self as perceived and self experienced. This meaning that being sick does not necessarily mean that the patient has a disease. She described that the illness as is a contention within the person. This could be conscious disharmony or unconscious disharmony. The dissonance then allows for the disease to manifest itself within the body and cause, of course, more disharmony. Watson focuses on the nurse's role when addressing the meta-paradigm environment. The nurse is expected to provide an environment which the patient is supported and protected. It is expected for the environment to be one that encourages a corrective mental, spiritual, and societal health. Watson believed that the healing spaces can be used to help transcend illness, pain, and suffering. The meta-paradigm is the nurse's application of their knowledge. The meta-paradigm nursing, is the application of the nurse's knowledge. Watson had curative concepts, which she proposed nurses focus on caring instead of curing. This was also to separate the practice of knowledge of nursing from the practice of medicine. The nursing paradigm is focused on holistic, humanistic, and open system wherein harmony, interpretation, and self-transcendence emerge, reflecting a shift. An example of how the theory is reflected in the nursing practice as a nurse is expected that we go beyond our care of tasks, techniques, and procedures. When providing, we must consciously emit caring energy. It is expected that we understand our patients' religious beliefs, their needs, and we build a comfort, trusting relationship with them and their family. Through a curative rather than a curative approach, our actions with our patients, we are able to build that trusting relationship which Jean Watson encouraged.